Smith. So I'm going to go over some key components of the plan. First, there will be a formation of a public-private partnership with a well-known adult mental health clinic provider, Hudson Valley Mental Health. Hudson Valley Mental Health started in 2006, providing services to adult clients in Dutchess County. Currently, they have 6 clinics that see about 3,000 individuals on an annual basis. Last year, our department sent out a request for interest to see who might be willing, able to come into our county and provide adult mental health care. And with that, Hudson Valley Mental Health did respond. They were really the strongest contender. We queried the providers in the local area, learned about their reputation. They're in excellent standing with the Office of Mental Health. And they really share our values of competent, accessible community care. The other key component of this plan, as Dr. Smith mentioned, is seamless transition and continuity of care. With the closure of our chemical dependency clinic in 2011 and then the children's services in 2012, a lot of our clients were uncertain about the future of the services that they've come to rely on for the last 30 to 40 years. This plan, Ulster Cares, guarantees that those services will continue and be stable into the future. So the way this will work is all of our clinical staff, meaning the doctors, therapists, the nurse, will continue in their county jobs providing the direct care to our clients. In addition, Hudson Valley Mental Health will lease our current locations. So the therapist providing the care, the location where they're getting the care will remain the same. Hudson Valley Mental Health will move into our locations in Kingston, Ellenville, and New Paltz. We'll be developing a transition team of our staff from the Department of Mental Health, Hudson Valley Mental Health, and consumers to have input into the plan and the proposal moving forward, and to ensure that we're in full compliance with all the regulations with such a change. So as a result, as you've heard, we believe there'll be no disruption in care for our clients or their treatment relationships with the professional staff that they've come to trust. Our department has 2 main roles, as Dr. Smith alluded to. There's the delivery of service with our clinics, and then there's the LGU role, the local government unit role. And that entails by statute the development of a continuum of care, including preventive, rehabilitative, and treatment services, the mandate to improve and expand existing community programs for people affected by mental health, substance abuse disorders, and developmental disabilities. Another key component of this statute as the LGU is to plan for those services, to guarantee access, competency, and quality of care. Ulster Cares enhances and preserves the LGU's ability to perform these vital functions. I want to share with you some of what those functions are, just a piece of them, because there are many. One of the things it will allow us to do is to continue to comply with the New York SAFE Act, the Secure Ammunition and Firearms Enforcement Act. Our partners in law enforcement, the hospitals, and the jail have identified that individuals are having difficulty when they come out of the jail, accessing entitlements and treatment services. We're going to remedy that. We're concerned that those barriers exist at a time when people are most vulnerable to relapse. We'll be better able to assist our partners in law enforcement as a result through regular dialogue and training of how to work with people with serious emotional disturbance. And we've recently resumed our regular meetings with the police from around the county and EMT services to problem solve some of the communication issues that have existed and improve safety for all concerned. Recently, community leaders have asked for more community health services, mental health services in the schools. We're in the middle of a needs and resource assessment with our partner BOCES, and we'll be working with them to identify those districts that want these services, and we'll expedite the development and licensure of those programs for the districts that want them. A major LGU role is the oversight of $7 million of state aid that comes into this county that's earmarked for the community mental health programs, care coordination, housing, vocational supports. So by maintaining the LGU and enhancing it, we'll be able to maintain this comprehensive system of care. One of the gaps when we started our county plan for 2014 that was identified by all the providers in our county is that we lack crisis or hospital diversion services. It's an intensive level of care. The LGU is going to now be able to commit to prioritize and procure funding for that critical service. Our department has led the suicide prevention efforts in this county since 1996. We've received many grants for youth suicide prevention efforts, and just last month we were awarded another grant which will help us address early screening and lethal means restriction. Last year, Ulster County lost 22 individuals to suicide. 50% of those were a result of gun deaths. And that doesn't include the number of individuals who made attempts at their life. The Ulster County Suicide Prevention and Education Awareness commitment is to build a competent community where stigma and fear take a back seat, and any of us can identify those we care about who are in that kind of distress and make sure they get immediate help. In addition, we're helping our county take the lead in the region in terms of incorporating violence prevention into our suicide prevention efforts. We know that our community needs a skill set to be strong and vigilant about those individuals that are at risk of harming others, as well as those who are at risk of harming themselves. And we are the clearinghouse for a lot of evidence-based trainings about suicide prevention, and we offer those to the community free of charge to schools, community groups, parents who want to learn more about suicide and violence prevention. And lastly, speaking of prevention, we seek a bolder role for the LGU moving forward in collaboration with our sister department, the Department of Health. We want to work together to promote mental health as an integral part of whole health.